Achieving sustainable retirement requires careful planning and attention to various aspects of life. Financial security is a critical component, and individuals are often advised to start early with retirement savings and investment to ensure a stable financial foundation. In addition to financial planning, healthcare is another essential aspect to consider. As individuals age, their healthcare needs may change, and it's crucial to explore options for healthcare coverage. By addressing these aspects of their lives, individuals can create a sustainable retirement plan that supports their overall well-being and happiness. This is a crucial conversation because I've seen a lot of persons, at a particular age struggle when it comes to matters of retirement, their health, and all of it. When you see people queue saying they want to collect their retirement benefits, some other persons fall down on the queues and die in the process. That's also as a result of their health. Recently, I was speaking with someone who is in her 50s, and she was talking about how she's not even understanding her body anymore. She doesn't, today everybody is feeling okay, she's feeling hot, and she's not even understanding her food is not digesting the way it should. Her body system has just changed, and she doesn't even know what to do. But she had to go to the hospital, and when she went, the doctor told her, these are menopausal signs and symptoms, and she was like, really? So the doctor had to take her through how she had to take care of herself. So it also affects men too. Some do not even understand what is going on with them.
Okay, I thought you wanted to talk about men and menopause.
Oh God, Ibrahim.
It is young man.
But you see, one has to say this conversation is crucial.
Yes,
We need to talk about aging and retirement, how best to plan. Etuma.
Yes, it's good that young people listen to these things, because there's something about being young. You just feel that you can do anything, you can bulldoze your way, you can do this, you can do that.
Yeah.
There's this young man that I know that drinks heavily. He consumes alcohol a lot. So I had to sit him down and say, hey man, right now your body can take it, but that strength that you have now, this heavy consumption of alcohol is depleting that strength, and you do not know.
Yeah.
And then one day, just one day, you realize that your body can't take it no more. You start developing things, one ailment after another. Getting old is something you prepare for. It's like getting pregnant. You prepare for that too. You have to start learning how to eat right at the right time. You have to do everything in moderation, and you have to save money just in case. What I used to do is anywhere I move to, I identify a hospital that I like, and I'll do my own HMO with that hospital.
All right.
Every month I'm paying you this amount of money. You take care of me and my family. Now, it doesn't matter if anybody gets sick or not, but every month I send this amount of money to this hospital. By doing that, you create a relationship with the hospital staff, and they give you information. And I realize that information is even more important than treatments that you get.
Absolutely. And that brings me, you spoke about saving, and I just want to, because some parents see their children as their retirement benefit. That's the aspect I also want for us to touch on, because some will tell you, I'm investing all my monies on my children because I believe that when I am old, they will take care of me.
Okay, but just to say to that, it's even in the Bible where it said that you need to take care of your parents when they are aged. But I also think that as parents, it's also wrong to just say that my child is my retirement plan. But in the Bible, we know that if you are capable, you need to take care of your parents. But this brings me back to the health issue we're talking about. I tell people the way you live now will determine how your old age will be.
Absolutely.
And we've seen how young ones are living. It is absolutely not the best, very reckless. Now, Veronica, you cannot be old, sick, and poor.
That's a terrible combination.
Because we are aware that God is the giver of life, but if you don't have money to take care of yourself, it's a big problem, and that is what a lot of our aged people are facing now. When we tell our children to be our retirement, you have some children that are bad. there are children that are rich and are not helping their parents. So even as a parent, you need to understand that anything can go haywire. So you need to take care of yourself. You need to save. And that's a culture which people do not understand.
But were they wrong by, you know, using all their strength to work and also say, you know what, because I gave birth to this child, I want to take care of them with the best way I can. The education I did not get as a parent, I want my children to get it. That is why I'm investing so much in them. Was that bad? It's
not a bad idea, but anything can happen. The devil can enter the child. I know children that are rich and don't help their parents.
And God will help the children or the parents. The son will get married to someone who want to take their son away from, you know, the family. Because there are some wives like that. There are some wives that will make, you know, the son be very much dutiful to the parents, even when the son is old enough. But the thing is, just like everyone had said, one should prepare for one's old age. But it's just so sad when we have people who work for the government, who work for companies, who work for, you know, for retirement at the end of the day, and their pensions are not remitted, their pensions are not paid. And when they've done all of this, to access it, this paltry sum, you know, because now if you ask some people, how much is a pension? They'll tell you just 2,000 naira monthly. What is that going to do? Some people will be on the queue, and then from there you'll find them slumping and all of that. What do we do about that? So, and I know of some, you know, people in the geriatric age where they are already back to farm. Some will invest in farming and all of that. By the time they are done, you see them going to farm, they are very active. What kills these people fast is because when they were in active service, their body, all of the faculty of their senses, you know, is very active. And then by the time they retire, they become couch potato. They sit back, watch the TV, press the phone. Now that phone is even here, you know, the internet, some of them will just be in one place watching TV and all of that, and then the body will be degenerating. Even as a young kid, if you're not active, you die fast.
Absolutely. Talking about being active, our aged people need to understand that, yes, you may not have the strength to do the rigorous exercises, but you can take walks. You can just, after eating or even before eating, just go around your environment, take walks, just sit by a tree, just do something. Ensure that you are not sitting in one position. My mother, for instance, every evening she's taking a walk. Even before she eats, or even early hours of the morning when the sun is up, talking about vitamin D and all. She's just tries to go out, and she's over 70. She ensures that she gets the sun, and you know, she's healthy as much as possible, because she says she wants to be playing with her grandkids. And
Amen, definitely.
Just a piece of advice before we go. You mentioned the Bible and asking children to take care of their parents. The same Bible also says that a man that does not leave inheritance for his children is an infidel. You understand? That's just to point out the importance of savings. And then you really can't invest on your children, and that's your whole retirement plan. What if it doesn't happen?
Definitely not.
You have to look out for yourself. Look out for yourself.
Right. Unfortunately, we need to wrap up this conversation. There's so much to be said, but so much has been said, guys, with regards to this.